of Life World Outreach Missions.
Have you ever sat beside someone in the car and the person turned to talk to you, or maybe you asked them something and the person turned to respond, and as they opened their mouth to speak, you're like, you try to hold yourself not to make it too obvious that you perceived a bad breath. Today we're talking about halitosis or bad breath. Many people really have this bad breath. That's something that I would say can be avoided. Let's talk briefly on what causes it and what you can do. Like I said, briefly, very briefly. So one of the causes of bad breath is the food we eat. Items like garlic and onion, yes, often leave our mouths with some odor. And when we consume them, until they leave the bloodstream, you may keep having this bad breath. And another cause of bad breath is poor oral hygiene. That's in fact the commonest cause of bad breath. Poor oral hygiene. Either you're not brushing your teeth, oral cavity, so to say, as often as you should, or maybe you're brushing it often but not all the components that you're supposed to brush. Please note, when you eat food and it stays on the tongue, it stays on the teeth, these food substances on the tongue and on the teeth can get rotten, and it would produce an unpleasant smell or odor in the mouth. So what you're expected to do is brush your teeth regularly, brush your oral cavity regularly, at least twice a day, and then use your dental floss. I don't know if you can see this, but I think most people are familiar with this. We use this side like a toothpick, but this is a dental floss. In pharmacies, you can also have dental floss that are just, the string without really being attached to this other portion. You can find it and you use it to remove particles that get stuck in between your teeth. It can be meat, it can be anything that you ate. Use it after eating. It's really going to change a lot, and why not put an end to this? But please, if after taking care of your oral hygiene you still have a bad breath, seek medical attention, because there are so many other causes that I won't discuss in this video. It can be infections, even infection in the lungs, sometimes infection of the throat, sometimes infection at the, maybe your tooth, your gums can produce this bad breath. So if just taking care of your mouth and avoiding some of these food items or hydrating well doesn't solve the problem, then see a medical practitioner for a proper diagnosis. Here, we're just giving you tips. If you need more counseling, you can let us know, but tell us what else you would like to hear on our show. Thank you.